Tell me a little bit about MILD.
It stands for minimally invasive lumbar decompression. This is a procedure that we do to treat a condition called spinal stenosis. So let's talk about spinal stenosis. Very prevalent in our older population. As we age, we get arthritis in our back, we have degenerative disc, certain ligaments in our spine get thick. When you get all these things that are getting overgrown and thickened, it narrows your spinal canal, which is where your spinal cord is. And it can narrow it to the point where it can't send its signals well. What that usually results in is the patient saying, I can't stand and walk very far. They typically will say something like, I feel pretty good when I'm sitting down, but I stand and walk, and it's usually like a pretty reliable thing. They're like, I can go to the mailbox, but I can't get all the way. I get halfway back and I gotta sit down. Or I can get to like the produce section of Kroger, but then I gotta sit down after that.
I've heard it as shopping cart syndrome before.
Yeah, and so the other thing they'll tell you is, like, I lean forward way over the shopping cart, and that helps me go further. What that's doing is creating a little bit more space in your spinal canal, relieving some of that pressure on the spinal cord and allowing you to go a little bit further in that flex position. A lot of times people say it's like my back starts to hurt and ache, and then my legs get heavy and weak and tired, almost to the point where like I can't even move them. And they sit down and, it pretty quickly improves and gets better. And they say, well, I can get up and I can go again for, whatever amount of time. And so it's a pretty debilitating issue. And
I would imagine working people, this is like very, very noticeable.
Sure.
Guys that work on their feet or factory workers, things like that.
Sure.
This is probably something that really they would notice
absolutely
quite a bit.
And so this MILD is a treatment for that condition. And if you were to go see a surgeon, they would talk about doing like a laminotomy or laminectomy and actually taking off a whole piece of the bone to open up that spinal canal and create some space. Well, very specifically for MILD, this procedure debulks a thick ligament that we get there called the ligamentum flavum, and it gets calcified as we get older, and it creates that spinal stenosis. And people, smarter than you and I have found out that we can go in with a couple of small tools through a small incision, and we can thin out that ligament some, and by just thinning out that ligament a couple of millimeters, people get tremendous relief from this. And that it doesn't have to be as aggressive as a big surgery. We can just take out a little bit and people can get a huge result. So the procedure probably takes about 20 or 30 minutes. It's not very long. It is done with some sedation on board. Full general anesthesia with a breathing tube and all that stuff is typically unnecessary. We can typically do this through one incision that's about 1 centimeter long.
So it's really minimally invasive.
Incredibly minimally invasive. There's a 5 millimeter port that we put down, and through that port we have 2 tools. One is used to kind of chip away a little bit of the bone and open up that space a little bit. Very, very, very small amounts. We're talking about like tiny amounts. And then the other one, it's kind of looks like an ice cream scoop almost, and we go in and we scoop out that thick ligament. And like I said, it usually takes about 20 or 30 minutes. Minimal recovery. I think with all these that I've done, I've only written like pain medicines for like 1 or 2 people. And we usually have really good results. People will respond to this procedure in one of 3 ways. One, they'll get like immediate relief. It's not uncommon that patients get up and say, man, I already feel better just walking out of the surgery center after having the procedure done. 2 is that sometimes it takes a couple of weeks for patients to get pain relief, so that maybe there's some swelling there, but those patients take about 2 weeks to get the full result. And then there's another group of patients who will get that full relief in about 2 months.
But some people walk out immediately.
Yeah, certainly. Majority of what we see is in that first 2 weeks.
Wow.
And people, I think, are very happy with that procedure. The great thing is that it doesn't prevent you from having a big, say it didn't work well for you, or you still needed to have a surgery. It doesn't prevent you from doing that down the road. It's really as safe as an epidural injection based on the studies that have been done. I've found that it's similar in my practice as well. So I think that if you have that issue, see if you're a candidate for MILD first. Try that first, and if that doesn't work, then maybe you can still have a surgery if you need it. But shouldn't we try like the least invasive thing first before we just jump to surgery?
Oh, I think that's great. So basically, they can try that before they go in and get the hardware put in. This is
correct.
Worst case scenario.
Correct.
It doesn't work. and they can still go forward with the next thing.
Correct. And there's a lot of circumstances where it does help. Our patients, a lot of them with this procedure are 70, 80 years old.
Oh, wow.
Yeah. They probably, well, they don't want to have a big back surgery for a lot of reasons, okay? Maybe they have a heart condition or a lung condition and they can't tolerate a big surgery. So this is a great option for people like that. I mean, little to no recovery time with this versus if you have spinal stenosis, you're probably going to get a fusion. It's probably going to be multiple levels. If you're that age, you're talking several months to a year recovery.
Wow.
So that's not a small thing. And a lot of people, they're like, look, I don't have help at home. I live alone. You know, my kids live in Colorado or California or wherever. They can't be with me for months at a time to recover. So there's a lot of reasons for people maybe to opt to do this first before they would have a back surgery.